We have a 35-year-old patient with sudden-onset right-sided facial weakness. There's no forehead sparing, and they report difficulty closing their eye and mild changes in taste. How do we determine the lesion site? We need to use topographic tests of the facial nerve. The facial nerve has multiple branches, so testing different functions can help us localize the lesion. Let's start with the Schirmer test, which measures tear production by placing a filter paper in the lower eyelid. If lacrimation is reduced, it suggests involvement of the greater superficial petrosal nerve, which branches off early from the facial nerve at the geniculate ganglion.
Right.
If this test is abnormal, it means the lesion is proximal, likely near or before the geniculate ganglion. Next, the stapedial reflex test checks for hyperacusis, which is sensitivity to loud sounds. The stapedius branch of the facial nerve controls the stapedius muscle in the middle ear, which dampens sound vibrations. If this reflex is absent, the lesion is between the geniculate ganglion and the nerve to stapedius, typically within the mastoid segment of the facial nerve. Now for taste. The chorda tympani, a branch of the facial nerve, carries taste from the anterior two-thirds of the tongue. Electrogustometry measures taste perception using electrical stimulation. If taste is impaired, it suggests a lesion distal to the stapedius branch, but before the chorda tympani exits at the petrotympanic fissure. Lastly, we test salivary secretion. The chorda tympani also carries parasympathetic fibers to the submandibular and sublingual glands. If salivary flow is reduced, we confirm chorda tympani involvement. Since this branch exits near the petrotympanic fissure, an abnormal result means the lesion is likely in the infratemporal segment of the facial nerve. So, if all tests are abnormal, the lesion is proximal, near the facial nerve origin. But if only taste and salivation are affected, it's more distal, near the chorda tympani exit. Exactly. This approach is essential in differentiating conditions like Bell's palsy, usually post-geniculate, from more proximal lesions like a facial nerve schwannoma or cerebellopontine angle tumor.